All right, so we're going to talk today about the muscles of the head, neck, and vertebral column. This is actually going to take quite some time. I'm going to break it up into some short videos. I'm going to basically do the muscles of the face, and then I will do the muscles of the rest of the head and neck. Then I will do some other things to break it up so it's not one big, long, gigantic uh, video. So, muscles of facial expression, these are the ones, the muscles of our face. They commonly insert into the skin and connective tissue on the face. These are the muscles that are going to produce those subtle changes in the structure of the face when we smile, when we frown, when we squint, all of those, raise our eyebrows, all of those things. One major point of attachment of these muscles is the epicranial aponeuroses. As you will see on the next slide, this is a broad band of tendon-like tissue that goes all across the top of the skull, up above your forehead. For many of you, it would be sort of right underneath your hairline, but for me, hairline is no longer a thing that I have. But again, it would be in this general vicinity right here. The jobs of most of these muscles are to move the skin and tissue around in your mouth, but specifically around your eyes. You have the orbicularis oculi, which is the muscle around our mouth that gives our mouth the ability to some of the fine manipulations required for speech. The levitator palpebrae superioris. If you The palps are referring to lips. Levitator means to lift them up. Superior, this is your upper lip. And the corrugator superculi, that is another muscle which I'll point to in just a second. So here is that epicranial aponeuroses that I mentioned, the broad band of tendon-like tissue up at the top of your forehead. There's the corrugator superculi, which I just mentioned. That's the muscle that's going to raise your eyebrows. There's the orbicularis oculi. And if we jump back, the levitator palpebrae superioris. For some reason, they talk about it, but they don't show it. This muscle right here that runs down and pulls up the medial portion of your upper lip on each side. The movement around the mouth and surrounding skin provided primarily by the zygomaticus major, the zygomaticus minor, the levitator labii superiorus. Again, labia is going to be referring to your lips, and the rosaurus muscle. The orbicularis oris is critical for controlling movements associated with eating, drinking, and speaking. Again, that's going to be the muscle that forms around the mouth. Let me back up a second. I think I misspoke back here. The orbicularis oculi, I apologize. That is the muscle around the eye that causes us to close and squint and those kinds of things. I got a little bit ahead of myself. So the levitator palpebrae superioris, not the lip, I apologize. That is going to be the muscle that lifts the eyelid, the upper eyelid. And it's going to be, there's the orbicularis oris, the eyelid, with the eyelids being cut away on this view. The reason they don't show that muscle is because it's been dissected away. But there's the corrugator supercili. Whoops, went one too far. Again, the orbicularis oris, around for eating and drinking. That's this muscle right here. This muscle grouping, the round grouping there. There's the rosaurus muscle, which is what pulls this muscle that allows us to smile and grin. And the levitator anguli oris. That's all the muscles, the levitator labii superioris. There's the muscle attached just below the eye in the orbit, but its job is to pull the upper lip up when you do that. To convey negative emotions, these are the ones that sort of turn the corners of our mouth down, that bring our eyes down, show sadness. The depressor anguli oris, the depressor labii inferioris, and the mentalis. The mentalis muscle is going to be one down here. This is referred to as the mental region of your chin. The buccinator compresses the cheek, which manipulates food while chewing, and the platysmus muscle is the broad, flat sheet of muscle covering the anterior portion of the neck. It pulls the chin down, helps open the mouth. If you do this, these muscles that you see right in here, those are, or that is a portion of the platysma muscle. So where's the platysma? It's got to be on here somewhere. Here it is. There's the platysma muscle, the depressor anguli oris, the depressor labia inferioris. Again, that's the one that's going to pull the bottom lip down. This pulls the corner of the mouth down. There's a chart showing all of these muscles, the types of arrangement they are, where their axogen as origin and insertion. I will give you, before your next exam, a list of major muscles that I will expect you to know the origin and insertion and principal action of. So for instance, you have the action of the frontalis muscle, for instance. Elevates the eyebrows, wrinkles the skin of the forehead horizontally. It originates on the epicranial aponeurosis. It inserts on the skin of the eyebrows. The nerve is the facial nerve. More than likely will not ask you about the nerves just yet. That is a chapter unto itself. But on these, I will ask you for origin, insertion, and principal action. Again, I will be giving you a list of these within the next few days. It will come out as a document. Just be a simple Word document, or it'll be a Word document that says, muscles of the face, know these, muscles of the neck, know these. So I will give you as opposed to knowing 300 some odd muscles, I'm going to expect you to know about 30 or 35 muscles. The eye, each eye has 6 muscles attached to the outer surface, which allows for quick and accurate movement. They direct our vision. These are the muscles that move the eyeball itself. Don't have anything to do with opening and closing the eye. These are the muscles of the eyeball. Move the eyeball left, right, up, down, up and to the left, up and to the right, down and to the left, down and to the right. You have 4 rectus muscles, which are the superior, inferior, medial, and lateral rectus muscles. They are named for the straight line they take from the origin, the posterior and the posterior orbit, to their more anterior insertion on the eye itself. You then have the superior rectus muscle, allows the eyeball to look up. The inferior rectus allows the eye to look down. So as you are thinking of an eyeball, the superior rectus muscle is going to be attached at the top, and it's going to make the eye do this. The inferior rectus muscle is attached under here. It's going to make the eye do this. The lateral rectus muscles allows the eyeball to move lateral to the orbit. Lateral means to the outside. So it moves the eye that way. It's attached over here and moves the eye that way. The medial, make sure I'm keeping in the right order, is attached over here, and it's going to move the eye this way. So this is my eyeball. Superior rectus this way, inferior rectus this way. Back up so you can see my hand. Lateral, looking to the outside. Medial, looking to the inside. The superior and inferior oblique muscles are the other 2. The superior oblique muscle runs from the origin in the posterior orbit through the common tendinous ring and the trochlea, which serves as a pulley. We'll talk about that one in a minute. Just before the muscle inserts into the anterior eyeball, this rotates the eyeball downward and toward the lateral side of the orbit. So the superior oblique muscle attaches over here, and its job is to move the eye this way, down and to the outside of the body. The inferior oblique muscle doesn't originate from the posterior orbit, but from the anterior and medial aspect of the orbit, runs underneath the eyeball, inserts in the posterior and lateral aspect of the eyeball. So it attaches, again, here's my eyeball. It's going to run over here and attach over here, and it's going to rotate the eyeball upward and outward, up and out. You got one going up and out, one going down and out. And there are those 6 muscles. There's the common tendinous ring, which all of the muscles go into, with the exception of this one. Here's the superior oblique muscle going through the trochlea. There's the superior rectus muscle. There's the lateral rectus muscle. There's the medial rectus muscle. There's the inferior rectus muscle. And there's the inferior oblique muscle. So as this muscle contracts, it's going to move that eyeball up and away. As this muscle contracts, whoops. As this muscle contracts, it moves the up into the middle. And there's just simply another view of where these different muscles attach onto the eyeball itself, showing there's the superior, again, there's the trochlea, which is a structure that is attached to the orbit. This acts as a pivot point for this muscle. So as this muscle tightens, it's actually going to pull the back of the eyeball down, which is going to make the iris and the cornea go in that direction. Again, same chart as we had on the other, with the, again, principal action, the origin insertion. Again, I doubt that I asked you for the nerve involved. We will talk about all these nerves when we talk about the cranial nerves in the nervous system in a couple of more chapters. Okay, I'm going to stop right there. That's about a 10-minute video, so I'm going to stop and I will start over again with the muscles of the head and neck.